Hello, I'm Dr. April Moreno, and I'm here to welcome you to COVID-19 Public Health Policy and Culture. We're here at episode 19 today, and we're going to be talking about what it's like to experience COVID in our own family and what's been going on in terms of public health and social movement even out there. So today we're speaking to Kristin Urquiza. She is the founder of Marked by COVID, and she's here to share a powerful story with us. Thank you so much for being here today, Kristin.
Thank you so much for having me. I'm looking forward to the conversation that we're about to have.
Me too. Thank you so much. Please introduce yourself a bit more to the podcast.
Sure. So I have been actually an environmental advocate for a majority of my career, and I've been looking at public health from an environmental standpoint. So the organization that I work with, Mighty Earth, we try to prevent pandemics by keeping tropical rainforests preserved. And it's really important not only for that issue, but for indigenous land rights and also for, mitigating climate change. So, very early on, whenever, the pandemic started to make headlines, I was concerned. I had also friends who are doctors and epidemiologists who were, I was conversing with, and they were saying, this is a really big deal. And I'm not sure if the response we're taking so far is what we need to be doing. And that, that scared me from day one. And so I've been very vigilant in trying to, share that information with, my friends and my family. But kind of thinking about how has COVID affected, my life. I worked really hard to protect my parents who are in their mid-60s. They live in Arizona, which is a very particular state that has a lot of Trump supporters and a lot of folks who basically have decided that science and doctors, their expertise doesn't matter. Mm-hmm. And despite my efforts to keep my parents safe, I wasn't successful. I wasn't able to battle the misinformation coming from the Trump administration and from the Ducey administration. And, as a result, my father, listened to what he thought was safe to do, to meet up with friends, to go shopping after the rollbacks of the Arizona shelter-in-place order, and he contracted COVID-19 and passed away a couple of weeks later.
Mm-hmm. Mm-hmm. Yeah, I'm sorry to hear that. So tell us a little bit more about what you were seeing in the news compared to what he was telling you he was seeing in the news.
Oh my gosh. I mean, it's just like being on a different planet.
Yeah.
So my dad, he was very engaged with news and radio and social media platforms. Mm-hmm. And we talked pretty frequently, and some of the information he was sharing with me just made no sense whatsoever. I remember one conversation, right after the shelter in place was lifted, and my dad was saying, well, I heard the governor say that it was, unless you have an underlying health condition, it doesn't matter. You're safe. Go out, go shopping, take friends out, and, this was May 28th. We already knew then that, underlying health conditions, that was like a February thing. That was not a May thing. And, those were the daily conversations with my father where, I was working to help expand the information that he was getting. But, I'm just one person. And whenever he's listening to multiple news sources as well as social media, it creates a culture of misinformation, which has deadly consequences. And, that shouldn't be a death sentence. And that's what it ended up being for my dad.
Mm-hmm. Mm-hmm. Tell us a bit about, I guess, the circumstances in which he experienced the virus. What was the health, his disposition? What was going on with his body physically?
Yeah, I mean, he was otherwise a healthy, no underlying condition, 65-year-old guy who was quite literally the life of the party and a big,
Mhm.
so I mean, just very active guy who, was, my family tends to live in the 90s, into their 90s. So, had a lot of life to live. He got sick on June 11th, and the day before he was completely fine. He woke up with a fever, a severe cough, and fatigue, unlike he'd ever experienced before. And talking to my mom, she communicated to me, I've lived with your father for 48 years. I've never seen him this sick before. We quickly, scrambled to figure out where he could get tested. But we never got the results of that test back because his condition just worsened over the course of the next couple of days. And we knew we had to take him to the hospital because he started to have shortness of breath and trouble breathing. And, I, throughout this entire few days, had the CDC guidelines basically pasted, on my desktop, and was, you know, religiously walking through each of these multiple times a day with my mom and my dad to just kind of track his symptoms, to make sure that, if things were progressing in a bad way, that we could act quickly.
Mhm. Mhm.
My dad, I will say that my dad was taking, this very seriously, but also at the same time, he was convinced that he would get better.
Mhm.
Um, while he was in the hospital, he started to feel a little bit better the first few days there. Um, and, we were texting, and chatting, and he would send me pictures of his hospital food. He loved food. So even hospital food did not scare him away.
Mhm.
And, saying, I'm going to get out next week. And, I'm really looking forward to coming home. And, it just worked really fast on him. And, he, even the day before he went into the ICU, which was, he went into the ICU on a Friday, the 26th, that Thursday, he was saying, I think I'm going to be home by Monday. And he passed away on Tuesday.
Mm. Yeah, it just has these very sneaky characteristics, right? So there's a certain day where people feel better, and then all of a sudden the next day they're like completely the opposite. It's just very drastic and sudden, and it just has these stealthy characteristics, this
Yeah.
virus.
Yeah. I mean, when he went into the ICU, he was in, critical condition, but, he was able to stabilize on the ventilator, and the ICU doctor, communicated to us, pretty much that he felt like my dad had a really good chance that he could also potentially be in the ICU for upwards of 2 months, and that we should prepare for that. And so his organs were doing really well. His vitals were really good. He was responding well to the ventilator. And, this was the day before he passed. I was having this conversation with the doctor, and the next day, just something happened over the course of a few hours, and he took a turn for the worst, and rapidly began deteriorating. And in
Mhm.
speaking to the doctor, I could tell the doctor was just so, upset.
Mhm. Mhm.
He didn't expect this for my dad at all. And
Mhm.
still in those moments was communicating to us, like, he's now in severe condition. We've seen people pull back from this, and we will continue to fight for him as long as his heart and his blood pressure remains stabilized, and we can stabilize it. But, eventually they couldn't.
Mhm. It is so interesting. Even though he truly believed that he was going to be okay and that he was getting better, that he would see you in the next couple of days at home, that still it just like all happened. It's just so interesting that some people are able to get through it with underlying conditions. Healthy people are sometimes not able to get through it without underlying conditions. It's so unpredictable. And I just don't even know like how to even talk about the course of what's going on physically, physiologically.
Yeah, I mean, I think that, it just goes to show how new this is, and
Exactly.
we're still learning day and day and day what the medium, long-term impacts are, the short-term, medium, long-term impacts. And,
Mhm.
that's why I think it's so important that we are really approaching policy and leadership with the utmost caution,
Mhm.
at least from, all of the conversations that I've had with doctors, epidemiologists and others. They have communicated to me that there is a way that, well, one, we're being forced a false choice,
Mhm.
that we need to either choose public health or the economy. And that's just simply not true. There is a way in which we can have a balance between the two that minimizes risk, minimizes transmission, and minimizes death. And this cavalier approach that the United States has taken, this is the toll. You and me having this conversation, and my otherwise healthy 65-year-old dad no longer being here. I feel as if he was robbed. My family feels like they were robbed.
Mhm.
And I know we're not alone in that feeling. I think that is what's happening to families all across the United States
Mhm.
who are, you know, asking themselves, did it really have to be this way? And I don't think so. I think this was preventable.
I agree, definitely, with the information that is available to us, the scientific evidence that is available to us. And I mean, there's enough out there that we're aware of, but then there's still this other realm of the population that is not seeing that information.
Yeah. And I think that goes back to the conversation we were just having about, media, news sources, and it's not everyone and not every news source, but there's just this misinformation that exists and has a microphone, which, there are folks that believe it, but then even the folks who don't believe it, I think it muddles the central messages that need to really be push forward within public health. And these simple things of mask wearing, of physical distance, of only going out for essential activities. And I live in California in the San Francisco Bay Area. We have been very on top of those key tactics to staying safe, but that's not the case in other places. There's just way too much, and it's just too much for people to process then, especially, you know, normal folks who are just trying to pay bills and, teach their kids at home and worry about that. It's just too much. And I think it's the responsibility of the people in charge to be uplifting the most simple, salient messages that will help keep us safe. And I've not seen that in places like Arizona, and I've definitely not seen that from the Trump administration.
Mhm. Yeah, and it's just very simple concepts. The way to fight this is very simple. This essential outings only for food and supplies once a week, taking a walk perhaps for a little while in the day, once a day, wearing the mask. It's really simple.
Yeah, it's super simple. And I think where it gets complicated is that we're not all having that consistent message.
Hmm.
And I don't understand why there's a refusal to do that. I see this coming. I don't understand why this is a political issue at all. This is about public health. And the other thing that I keep seeing again is that there's just no reopening strategy on the national level that allows us to have a real conversation about how do we do this in a way that minimizes the impact and the risk. And it feels to me that on some level that the Trump administration wants this to happen, and I can't reconcile that.
Hmm.
The only thing that I think about is just, oh, who is this disproportionately impacting? This is disproportionately impacting a set
Of
of the
color.
maybe the Trump administration doesn't care as much about.
Right. Yeah, and it's interesting because it does affect the population as a whole, but then there are disproportionate populations that are being affected more so than others. I saw recently that, I think it was yesterday's news, where the data for reportable conditions for COVID in a certain state, can't remember where, is not being sent to public health. It's going to go straight to the White House first. That is something I mean, that really takes away from the meaning of what a reportable condition is if you're not reporting it to your public health agency.
I was flabbergasted when I saw that, which further had me thinking, like, there is something else that's happening that we are not aware of. To divert data from the CDC to the White House means that we cannot trust anything that is being reported. And if we can't trust the data, then we are flying blind. And I'm not a scientist, but I talk to a lot of scientists, and the one thing that I hear time and time again from scientists is that we need more data, we need better data, and we need more research. And to bifurcate that is really, it's a red flag, and it terrifies me.
Yeah. So I'm really curious to hear about your approach. You're talking about these two extremes that we've been working with, like in this country. And you said that you believe that there's this middle ground. Can you talk to us a little bit more about how things could be different?
Yeah. I mean, I live in California, and we have had a uptick in cases over the last couple of weeks, like most states. But what I'm seeing our elected officials do is look at the data and respond to the uptick in real time. There's consistent briefings, there's consistent information available to the public, and then there's decisions that are made and communicated out as to why they're being made. So the governor here just decided that indoor dining would cease for the foreseeable future because of our uptick in cases. And that coincides with the fact that over the last couple of weeks, there's been more conclusive evidence that indoor dining creates a hotspot. And so, the thing that I really appreciate about living in a place like California is that it is more of a dance with the virus versus a strong arm. And what I'm seeing at the federal level, and then some of these other states like Arizona and Texas and Florida, it's almost like the governors are going to the hose and just cranking the spigot on the economy and letting the water overflow the bucket. And that overflow of the bucket are people's lives, like my dad. And what I see in places like California, Oregon, and Washington, that it's more of this like slow turn where we may turn a little bit too much, but then have to go back a little bit. But overall, the progression is the water spigot is turning on, but there's more finesse. And as a result, like, I feel safe. I feel like I know what I'm supposed to be doing, and I feel like the people around me are also doing their best with the best information. And that to me is this progress forward, where it is more of this 2 steps forward, 1 step back dance. And when we're dealing with a deadly virus, like we were just talking about, that we're still learning about on a day-to-day basis, we need to be approaching it as a deadly virus. Case in point.
Right. So simple to understand the basic concepts, but to get that word out to people, I think there's these elements of fear and these elements of misinformation that are really blocking a lot of this. Like, I get it. My family, I have parents and, the next generation in the same age range as your parents. And, there tends to be this sense of, nah, it's not that bad. There's this sense of, no, really, I think it's probably okay if I do this. It's okay for me to go and gather with my friends and family. It's really probably going to be okay. We're tough. We've gone through a lot of other things. We're in our 60s now. we're going to be fine, right?
Mhm.
And there's that sense of, I feel like there's a bit of fear in there too. Like, I don't want to feel it. I don't want to experience the possibility that we are experiencing our first pandemic in our lifetime here in the United States for a deadly virus. um, I think there's that element, that practicality, like I just want things to be, everything's going to be okay, and it's
Yeah,
not so bad.
to me really just resonates because, I was talking earlier today to my partner, and, even myself, who's been thrust into this situation and has chosen to speak out, was having, a little bit of an internal fit where I was saying, I don't want this to be my reality. Is this still my reality? Like, COVID is still happening, and just wanting to pull my hair out to really just protest, like, everything about our lives has changed.
Yeah.
And, one of the things that makes us really resilient as a species is that we're adaptable to change,
Hmm.
like, biologically, but I don't think that's quite the same in the mental space. I think we like our habits, we, like our creature comforts. And I think part of what is so challenging from more of like a human behavior perspective is that we are battling that internal desire to have things the way they were in January. And I think that part of what is exacerbating this pandemic is that we're not being real with people that, we will get to an eventual time, but that's going to be a long time.
Hmm.
Whatever that looks like, it's going to be a little different. And we are all changed as a result of that. And I just think being honest about that better prepares us individually and as families and as broader communities for that eventual time to be more resilient.
Hmm.
And I'm not seeing any of that conversation really happening.
Hmm.
And I think as a result, as you were saying, it makes it more difficult for us to keep our loved ones safe because is, everyone is approaching this differently. And it's really easy to, even in the context of this pandemic, say, that's not going to happen to me. And, I predict with the trajectory we're on, more of us are going to know someone who has lost their life or has been in a battle with COVID. The virus, viruses don't know national boundaries or state
Hmm.
lines or city municipalities. And this one in particular, I think is just, you know, you have to admire it at some level. It's been able to, really go deep into the area in which we are so special in our social networks and our physical presence with people. We are social creatures, and the fact that it really can transmit because of that closeness in our social networks. You know, I have to give it props. Like that's going to make it really resilient.
Right. It has thoroughly uprooted the way that we live around the world. It's just, yeah, it's really hard to, wrap our heads around that. Yeah. Um, Tell us a little bit more, in your opinion, about what the world needs to know right now.
I mean, the world needs to know that we can get through this, that we have survived other pandemics as a species, and we have survived. I mean, we are really resilient, but the way that we have done that and have been able to come back stronger is by working together. And this, I think, is, something I see in other countries. I'm inspired by the approach of the European Union and other nations that are, kind of a similar caliber to us. But, I think that the United States, we're not doing our part. And I think it's time for other countries to stand up to us and to help pressure our leaders to do right, not only by our us Americans, but do right globally. As long as the United States doesn't do its part, the entire world remains at risk. And that doesn't sit well in my stomach.
Right. Yeah, we are all impacted. We are all interconnected. Yeah, it's a very well designed virus.
Yeah, exactly. That's a really great way to put it. It is very well designed.
And it's going to be an opportunity for us to really change the way that we collaborate and navigate difficulty. It's going to change the way we work with policy, with public health, so
Yeah.
many things.
And I also think because of that too, it's an opportunity to, go back to the drawing board and examine like what wasn't working. One of the things that I, have studied a lot is just inequities in our society, wealth inequality, climate change, fossil fuels, and this, disruption is an opportunity to really reimagine our global economy, our carbon footprint, social safety net, and a whole set of things to help make us more resilient as a population and as a country. And so, it's a little bit of a long shot, but I think we should be asking for what we want. If there is ever a time to do that, this is the moment.
This is really the moment. In the public health space or in the public administration space where I was prior to public health, we were trained not to be politically, not to share our views. As we lead cities, governments, in public administration, we lead organizations, we were told to be very impartial because we have to serve the community as a whole. And it makes sense, but we are at a point where we're talking about people's literal life and death circumstances. We're talking about, even in this era, actual police brutality, racism, people actually getting killed in the street, in their own homes, sleeping. We cannot be in the middle anymore.
Yeah, I agree.
We cannot be passive to this.
I agree. Yeah. I mean, and I hear what you're saying, and I understand, the theoretical need for impartialness, but this is no longer that. We're past that threshold. And I think it's time for us all to be speaking out and demanding change. I mean, I think it's one of the most patriotic things that we can be doing,
right? I mean, that's really what the foundations were.
Yeah, absolutely.
I mean, the country was led by people who were rebellious and they spoke against governments, and here they are.
Yeah, here we are. And I think it's our patriotic duty to preserve and continue to iterate and improve upon that democratic promise, in which we are, far off the mark right now. But we have I think that's what's inspiring too, is that we have so much technology now. We have so many creative people. I mean, I've, through the course of the last couple of weeks have had an outpouring of support, and have been so inspired by people who are so engaged, want to make a difference, are asking, how do I get involved? What do I do? And I think that's part of the American spirit as well, is that we're really determined to make the world a better place whenever, we put our mind to it. I think we can.
Right. Yeah. And I think this is a very important moment, as you mentioned, and I haven't told you this, but you're actually the first person on this podcast who's actually experienced firsthand what COVID-19 can do to our bodies and to our lives, to our families. And you're the first person who's been here to share personally that this is real.
And you know what, I'm not surprised by that, because what I'm seeing is that, through my speaking out about my dad's death, that I, am been one of the first people to really kind of not only share what that experience was like, but also the first person to really say this could have been preventable. And it was poor leadership and terrible policy that got us to this position. And I know that it won't bring back my dad, and between us, that's what I would love more than anything. But I know that when people step forward and come into the light, we become so visible and so large that we can't be ignored. And so, you know, right now, by sharing my story, speaking to folks like you, your listeners, my hope is that more people will come forward, more folks will share their stories. And I think that's kind of the beginning of a movement
Yes.
to be able to prioritize sensible public health policy, going back to those easy things that we need to do, that we can do with, you know, a version of the economy open.
Mm-hmm. Thank you. And I agree with you. Unfortunately, I would love for people to come on here on the podcast and publicly in the media to more frequently share their personal experiences. We've seen a few out there, but we need to hear more. We need to really stand up to policy change and enforcement of protection for ourselves against this virus. But I do unfortunately agree with you that I don't think people are going to take this seriously until it really starts to hit home a little bit more, unfortunately.
Yeah. I mean, one of the reasons why I launched Marked by COVID was to create a platform for people to come forward, share their stories, not only to be able to start to put faces to the numbers, but also as a platform for people who are experiencing this to grieve together. You know, I have been so overwhelmed with positive feedback of, you know, the sort of movement that we're building, and it's really like oxygen to my soul. I think that, you know, we can personify this virus, and I think that personification will make a tremendous impact on our willingness to accept these decisions that, you know, these policy decisions that might seem mundane, but like we've been talking about, have real human impacts.
Mm-hmm.
You know, my dad and I just a month ago were talking about when he was going to come visit me in San Francisco. I could not have predicted this would happen. And that just goes to show that none of us are safe.
Mm-hmm. Right. Yeah, I like what you're saying about the faces to the numbers, putting an actual face to these statistics. It's going to make a huge impact. I agree with you on that. And I love the work that you're doing, Marked by COVID. And it is powerful when you share your story, when you share, and you know, through trials and difficulties, you have this new strength. You're just like, this cannot happen again. We have to
Yeah.
do something about this.
Yeah, I agree.
I really appreciate that you're doing this.
Thank you. I mean, I was inspired by the AIDS memorial quilt, which, you know, was also a kind of a similar time when we had this crisis. It was downplayed. And, you know, there was also a lot of homophobia at that time. And, you know, this was, you know, with the AIDS memorial quilt, it was really putting faces to those numbers in a really visible way that helped pressure politicians to take the virus seriously. And so kind of looking back at that,
Mm-hmm.
recognizing that we need a similar movement here. And, you know, it's up to all of us to push our comfort level. I'm actually a very private person, which I guess like you wouldn't know from the last week, but you know, I don't like sharing how I'm feeling. But I know that I need to, because
Mm-hmm.
if this is happening to me, this is happening to other people.
Right.
And I just can't let that go.
Right. Yeah. Now you're being guided by this purpose.
Right.
It's bigger than all of us. And yeah,
Absolutely.
it's affecting the world.
I hope so. I hope so.
Right. Yeah. Thank you so much for your motivation and your strength to be able to share your story. And I'm really, you know, my heart goes out to you for with what happened with your father. And I really appreciate that you've been here today to share your story with us on the podcast. And please share with us a little bit more about Marked by COVID and how we can connect with you on social media.
Yeah, absolutely. So we have a Twitter, Instagram, and Facebook group, Marked by COVID. My dad's name was Mark, so that's kind of where the inspiration for the name came from, a little nod to him. We also have a website, markedbycovid.com. We're asking people to share their stories on our website. so that we can start to amplify and personify this movement. We're also gearing towards a national day of action on what would have been my dad's 66th birthday, August 13th, and want to work with people all across the country to bring their concerns directly to elected officials, obviously in a socially distant, mask-wearing, safe manner. But for more information on that, it's available on the website. And then we're also raising funds in order to help sponsor more honest obituaries. One of the things that I've learned over the course of the last several weeks is that, people have said, thank you so much for writing that obituary in the way that you did. And, I had a loved one who passed, but I wasn't even able to afford an obituary. And so I want to make sure there's space for those stories to be told as well. It's important. And so we're raising funds to help sponsor those as well.
Thank you. You're doing some very important work right now. This is a historic time, and I really appreciate your work, your message, and your story.
Thank you so much for connecting with me and inviting me to be part of this podcast.
Thank you so much for being here today, Kristin.
My pleasure.
Thank you.